Hey you guys, Dr. Nicole here. I am here to answer today the question of what the heck does an internal exam in pelvic PT, what does that actually look like? So a lot of patients that have been told to go to pelvic physical therapy or have sought it out themselves and actually get the courage to go still kind of have these questions about like, what exactly are they going to do? So I'm here to tell you about what it actually is that we do and what position you're going to be in to sort of help to decrease a lot of the anxiety about the internal portion of the exam. First of all, we do a lot of other stuff before then. So we talk to you guys a lot. You fill out intake forms. We do an external exam first, but when we actually get to the internal exam, what the heck is this going to look like? So I have a female pelvis here. I'm going to show on a female, and I'm going to explain to you what we do with males as well. But we also have the choice to do a rectal exam with females also. So here we go. The one of the biggest questions that I get that people don't know is like, what do I wear? So most of the time when you come to physical therapy, pelvic physical therapy, want you to wear something comfortable. Some people come from work and so they don't really have any athletic things on, which is no big deal. But because we have you guys usually change into a gown, at our clinic, we actually have you take your undergarments off. Sometimes people leave their shirts on. We put you into a patient gown. And then for the internal exam, for us, you're going to be laying on the treatment table, usually with a towel over your pelvis area. So the goal of all of the gown and the towel is not to make it very medical, but it's in order to cover you the most that we can possibly cover you, except for what we need to expose for the exam itself. So for us, we usually have the gown over and the towel over that, and then we can lift up the towel a little bit in order to sort of peek and see. Sometimes we'll do a visual exam actually of the external pelvic floor area, but most of the time we don't need to like hang out there. It's not that like that. So what we do is we just insert one gloved finger into, for females, the vaginal canal. And that is just a little canal right here. And what it allows us to do is to be able to get into a lot of these pelvic floor muscles that otherwise wouldn't be accessible. When we're in the vaginal canal, we can go all the way back to the tailbone, and we can also feel everything along this side wall, all the way up to where the pubic bone is, where your bladder sits, and we can also get to some of these hip muscles. Again, these muscles are really not that accessible other than through the vaginal canal. If you're a male or you're a female and we choose to do a rectal exam, sometimes we don't do that the first day, but sometimes we do. And so depending on your symptoms, and that's something that you could definitely talk to about your pelvic physical therapist. But for me personally, I like to do rectal exams for musculoskeletal stuff prone, which means on your stomach. So you're on your stomach, pretty comfortable, again, covered everywhere with the gown and the towel draped over your glutes here. And we do a draping technique that just exposes this area here so that we can do one gloved finger inside the rectum so that we can actually go into and feel all of these muscles, including your tailbone. That gives us a ton of information as to what your pelvic floor symptoms might be there for. It gives us the ability to look and see, are the muscles, what is the status of those muscles? Are they tightened and kind of up like this? Are they sort of loose and don't know what to do? If we ask you to squeeze, can we actually feel them squeezing and lifting? Can you fully relax them? We really get a good picture of what that is. So that's a little bit about what position you're in. Rectal exams can also be done in side lying, and they can also be done with you on your back as well. It just depends on your physical therapist, but feel free to ask your PT to explain something to you if they're not already doing that. Most of the time we should be at least telling you guys what position to be in and making sure you're feeling comfortable with proceeding with the exam. So the thing is, I think one of the misconceptions is that, that you're going to be exposed or anything like that. We really try to keep everything covered pretty good. It's usually one finger. Sometimes vaginally we'll do two, but that's only if you can tolerate it. So we're just looking for those internal pelvic floor muscles. So we went over what we actually do and why. We went over what are you wearing. We went over the position that you'll be in. And then the other question that I get a lot is it going to be painful? And in a perfect world, my answer is no. That is definitely not our goal. Sometimes we want to actually see if those pelvic floor muscles are actually eliciting symptoms that you're otherwise feeling. So we call that in PT terms, reproducing your symptoms. So for instance, if you have bladder pain or dysfunction, then because of where the bladder sits right in front here of the pelvis, that sometimes these pelvic floor muscles here are actually irritated. So we can actually press on the pelvic floor muscle here, and every once in a while we'll be able to actually elicit something where somebody says, yikes, are you pressing on my bladder? And the actual answer is no, we're pressing on pelvic floor muscles. So that's called reproducing your symptoms. We are, as PTs, trying to do that, but not to be painful about it, but just to figure out, is that pelvic floor muscle creating some of the symptoms that you might be feeling? This is also true for things like hip pain. There's a couple of muscles that actually commonly refer to the hip muscles. So sometimes something that's really a nagging hip pain can actually be coming from the pelvic floor, and sometimes we're able to actually elicit that during the exam. So the short answer is that we hope that it doesn't hurt. Sometimes it can be sort of uncomfortable, but that really dissipates as we're in there and as we're assessing, and we can always stop the exam at any time if anybody feels uncomfortable with that. Yeah, I think that's kind of it. I really hope this helps to decrease a little bit of your anxiety. Every PT session is a little bit different. Every PT practice is a little bit different, but that's the general gist of what an internal exam actually entails. For us, it's all done in a private treatment room with a closed door, and anybody that comes to PelvicSanity's clinic has the option to have someone in the room or to not have someone in the room at the same time. So we'll commonly have spouses in the room, just to kind of be present, especially if it's for a painful intercourse type of situation where it's helpful for someone else to be in there, or it can just be the patient and the therapist and no one else is allowed. I hope that helps to decrease some of your anxieties and answers a lot of your questions as to what it's going to be like when we do an internal exam. Feel free to always email, DM on Instagram. I'm at Nicole Cozean DPT, or the clinic's Instagram is at PelvicSanity. And feel free to reach out with any questions that you might have. I hope this helps for you to have a lot of decreased anxiety when you go to a pelvic physical therapist.